Hi, I'm Rachel Kent. I'm nearly 18 months qualified and I have entered a statistical group that finds that nurses between 1 to 5 years of qualifying are most likely to drop out and leave the profession for good. Nurse attrition drops after the first 5 years, suggesting that if we can get people past that 5-year hump, we're more likely to be able to retain and keep our nurses on into the future. Those who do drop out within the first 5 years of qualifying are the least likely to return to the profession, as they often retrain and go on to other work and employment. A study by Heine et al. 2013 found that 44% of nurses wished to leave their current employer. 10% of the nurses surveyed wanted to leave the profession altogether. Burnout and job satisfaction was the number one reason for staff wishing to leave the profession. Workload and quality of care was the biggest reason for nurses wishing to leave an employer. A study by Health Education England has found that London has the highest rate of staff nurse turnover, ranging between 11 to 38%. So I guess the question is, why is it that nurses between 1 to 5 years of qualifying are more likely to drop out of the profession than nurses who have been doing it for longer? I'm here to find out why, and I've been asking some of my colleagues for their input.
Why am I leaving London, you ask? I'm tired of the poverty. Poverty of services, poverty of staff, poverty of patients, poverty of support. I feel that I'm no longer able to do my best for my patients, because my best currently looks like a woman spinning plates frantically, waiting not for just one but many of them to come crashing down. And they will. And they do. I'm not suggesting other places don't have poverty, but it's better managed, it appears. London seems to have forgotten who built it, who preserved it, and who should be the future of it. And thus, for me, that is too big a heartache to bear. I cannot continue to watch my patients suffer at the hands of cuts and waiting times, and to have to continue to be the smiling, unfazed face of having to be the bearer of bad news continuously. Plus I want a garden. Gardening is good for the soul, and I want some of that in my life.
London is just more exciting. I have nursed in other parts of the country and it's always the same. The same people, same problems, same things day after day. London isn't like that. It's always so different. There's more variety, more challenges every shift. I guess I can see for some people that it would eventually become too much, but that's what I most enjoy about nursing in London, and that's why I wouldn't dream of leaving. I would just miss it too much and get bored, and the worst thing you do to your career and for the patients is to be bored, when you're supposed to be caring for the people who need you to be enthusiastic, because no one else will do it for you.
Oh man, I don't like nursing, but I'm doing it because I need to work. But it's a lot of hard work, and it doesn't pay enough. I need the money to support my kids, but my hours are so long, I don't even see them, and I hate that. But even though I'm doing this work to support my family, my community looks down on me. Nursing is still thought of as women's work, so for me it's less culturally acceptable than it would be for someone native, which makes it harder unnecessarily. London is really multicultural, but sometimes that can mean less integration, because why integrate with new people when there's a whole community you're from on your doorstep? It's great, don't get me wrong, but sometimes attitudes that have no place are given space, which isn't a challenge, and not everyone thinks about that. Although it's good to see more BME groups and trusts, I hope more people will pay attention to that, not just promotions.
I was working in a hospital as a porter and really wanted more responsibility, so I became a nurse, and I've been a nurse now for 27 years. I lived up north but decided to move to London because I wanted to live in the most exciting city in the country. Over time, it was becoming too expensive to live in London. I was already living with other people, house sharing, in order to survive, and I was starting to want my own space, so I made the decision to go back north. I quickly realised that I wasn't going to be happy living back in the north. The people aren't as friendly, less culture, less opportunities, poor transport, and it just isn't London. I am going to give my current job another few months before handing in my notice, so I can come back to London as soon as possible, because I enjoy working in multicultural teams. The work is more exciting and more advancement in care with better transport.
From London to Loughborough, there are definitely challenges facing the nursing profession, including recruitment and retention. London does have its very own special trials and tribulations, but these are things that we can overcome, and that is what we're here to do. There are things that make London particularly special, and these are things that I think should be focused on to celebrate why it's so great to live and nurse in London, rather than focusing on the reasons why people want to leave. As a community, we can do this together. All we need is for everyone to speak up.